George, you were one of the first to hear about the senator's last moments.
He passed shortly before midnight, as you said, after a steady stream of family and friends have been visiting with him over these last final days. President Obama got the word just around 2 a.m. last night and was able to speak to the senator's widow, Vicky, at around 2:25. He'll be speaking this morning at 8:30 Eastern Time, giving his speaking to the country about his friend, his colleague, the man who in many ways helped get him to the White House, Ted Kennedy.
I'm remembering some of the emails that Victoria Reggie Kennedy sent out to everyone after the diagnosis, and also the notes that she was writing. She would always say, if you made him laugh, that was the gold star. We laughed and laughed at what you said, and that smile, that trademark smile, through his entire 15-month battle with brain cancer.
You always knew when Ted Kennedy was coming down the hallways of the Senate, because he almost preceded himself.
He did. He was his own amplifier. You could hear the sound of that voice from, well, corridors away anyway. Let's go to our senior congressional correspondent, John Carl on Capitol Hill. John?
Diane, you know, this really is just a colossal blow to the cause of Ted Kennedy's life, and that's the effort to get this health care bill passed. He had been involved in this right up to his last weeks, talking to his friend Chris Dodd, who had taken over his responsibilities on the Health Committee. But Ted Kennedy's absence from Washington over these last several months is really one of the reasons why health care was in such trouble. Now you're going to hear an effort from Democrats to talk about doing this in Kennedy's memory, basically turning the health care bill into the Ted Kennedy Memorial Bill, trying to use that as a rallying effort. But it's not going to be an easy cause, because he was the senator positioned better than any to get it done. And also, Diane, there's one other practical consideration here. Now there are only 59 U.S. senators, and as you know, that law in Massachusetts means that it will be 5 months before there's a special election to get a replacement for Ted Kennedy here in the Senate. That's something Kennedy himself was trying to change just in the last couple of weeks, but right now that remains the law in Massachusetts, and for now, unless that changes, it'll be 5 weeks before there is another senator from Massachusetts here to fill those mightily big shoes.
That's right. He asked for that to be changed, but not clear whether anything at this point can be done. I want to go back to what you said, though, John, because you mentioned that health care was his lifelong passion. 1962, when he declared for the Senate for the first time, it was a centerpiece of his announcement speech. And we just want to play for everyone. You listen to this with us, John, if you will. Dr. Tim Johnson standing by, who met over the years with Senator Kennedy about health care. This was Memphis, 1978, and he's talking about what is right at the center of his heart.
I had a father that was touched by stroke and sick for 7 years. We were able to get the very best in terms of health care because we were able to afford it. It would have bankrupted any average family in this nation. Any average family that is represented in this hall this afternoon, and the millions of people that you represent all over this nation of ours. I had a son that was touched by cancer. Extraordinary health bills that we were able to afford, and we received the very best. It would have obliterated and wiped out the savings of any family, mortgaged their savings, and mortgaged the education of their children into the future. 7 months in the hospital I was with a broken back and received the very best of health care. I've been able to receive it for myself and for my family. Just like all of us who are on the tip of the iceberg, way up high in the health care services. We've got the very best, all of us at the tip of the iceberg. But I want every delegate at this convention to understand that as long as I'm a vote, and as long as I have a voice in the United States Senate, it's going to be for that Democratic platform plank that provides decent quality of health care, north and south, east and west, for all Americans, as a matter of right and not a privilege.
Matter of right and not a privilege. Another signature moment for the senator. You know, you can go to abcnews.com. We have a whole list of videos there and moments that the senator brought, but nothing meant as much as health care to him. And Dr. Tim, it's an important thing because right now, the idea of it as a right, you know, that the senator is always pushing, that health care is a right, That is a real battleground right now.
It is, and he was always committed to coverage for all. He was at heart a single-payer person. He liked to speak of Medicare for all. But significantly, when he was one of the key architects in the Massachusetts state plan, he compromised. That is not a single-payer plan. It's more like a national exchange plan. And so while he had these very high ideals and never compromised behind doors, and when necessary, he was willing to compromise and get what he could as long as it was pushing toward the goal of coverage for everybody.
Well, he had learned over the years that you have to get some type of progress. You can't go for everything all at once. But interestingly, you believe that in the future, Senator Kennedy's dream of Medicare for all will be realized.
My guess, my prediction is that out of sheer necessity someday, 10, 15, 20 years from now, healthcare costs will be so out of control that we will go to, in essence, a Medicare for all plan. That's my prediction. I may not be around to see it, but you can check me.